Okay. Good afternoon, everyone. How are you guys?
Okay,
Yes. Okay. Thank you on your response. How about you, Alesna? Are we good?
it's all good.
Yeah. So, we're going to start our small group discussion. So, it's about uh, the goals of counseling sa dispensing and naay mga theories. So, what are the theories sa ato ang counseling?
May kay koan behavioral
Behavioral
theory,
theory.
humanistic approach, tapos eclectic theory.
Yes, yes. So, naay case study diri. So, atong siyang ang gihatag diri niya kay uh nani in case study 1, use the roots of counseling on the following patient. So the patient is a diabetic patient who does not adhere to his maintenance medication and apply the behavioral theory and the humanist approach to the to counseling. So as we all know, no, behavioral theory is katong something rewarded. Sakto ba to? Wait, sa akong kuan dere. No, behavior that is reinforced or is repeated or behavior that is not reinforced or what is actually punished or is not repeated. So, unsa may makuan na to? As a pharmacist, in terms of behavioral theory, unsay what could be our approach. Say wait, kanang pwede kana basahon sa nato ning behavioral theory kisay makakuan, kisay makabasa please.
Ako na lang. Behavioral theory has a lot going for it. Its scientific methodology is the strongest of these advantages and also the most visible. A wide range of disorders have been successfully treated with the help of extremely effective approaches developed through empirical testing and applied in behavioral therapy. Since behavioral therapy identifies and targets a specific issue the client wants to alter. It can also be completed in a very short amount of time. Behavioral therapy gives a high level of ethical accountability because it exclusively focuses on how to change a specific problem. The client has a considerable level of discretion in determining the aim of their therapy, and there is no bias towards what behaviors should be modified. Clients are advised of what will happen and the procedures that will be. Sa
So,
ako ani no sa kay ma-adapt man gud ni sa example as pharmacist mo nang usa sa reason mag sa behavioral theory ang patient kay tungod sa ilang environment gani. For
mm.
example, kanang bawal sila ani nga food. Kunya na makita nila sa ilahang surroundings nga nag-ito chocolate syempre matempt bitaw sila. So ingana dapat control jud ang environment nga kibaw sila na sila ingana nga patient mulikay sa lang sila.
Yes, from the word behavior. So, sila ang kanang kumbaga sila ang patient, sila manage sa ilang kaugalingon, di ba? But you know, mo na kaning na diri sa case study ni gibutang diri nga the patient does not adhere his maintenance medication. So, what could be? Is there any reason behind nga nung nahitabo ni siya, nung gibuhat niya ni kay maybe through counseling mabalaan nato no ang reasons, di ba? So, let's next slide na to. as a role of pharmacist akong kanha. Next slide. So kani, role of a pharmacist in the diabetes management. So due to the significant gaps between reaching goals of optimal medication therapy and the current state of medication use, the pharmacist's role in caring for the diabetic patient has expanded. Pharmacists utilize their clinical expertise in monitoring and managing diabetes medication plans to positively impact health outcomes and empower patients to actively manage their health. So I agree with this, no? Mujud niya tong role as a pharmacist. We are kanang kumbaga kana ba gani,
Educating.
we value life sa every patient kay because mo man atong gipili nga profession healthcare linya sa healthcare. So sa unsa man agree ra mo okay na mo ato nga najud tay party najud tay part as a pharmacist sa kani nga case study sa diabetic patient nga wala siya ni-adhere sa iyang maintenance medication. So, mabalaan nato ni sa counseling. And unsay flow sa counseling, unsay mahitabo sa counseling, ug unsay naa sa counseling. Palihig kog read ani Miss Esquivel.
Uh, So first one is counseling regarding the disease. So the diabetic patient should be explained that the disease is lifelong, progressive, and needs necessary modifications in the lifestyle pattern. Strict compliance with the prescribed medication, where diabetes is a chronic illness that requires continuing medical care and patient self-management education to prevent acute complications and reduce the risk of long-term complications.
Yes. So mo ni siya naa sa counseling regarding the disease kana sa diabetic patient. Explain na to balik usab no nganong kinahanglan siya mo take ana unsa na nganong naa siya nagkasakit siya inana ba. Kay maybe this patient is kanang is old or kanang murag need na jud siyang ipa-remind ba, no? Samot na nga required jud siya og medical care, patient self management sad kay syempre ang pag-take sa medication niya di ba dili man kita ang sige og kuan ang sila na ang ato ang role is mo instruct mo dispense mo educate sa patient about sa ilang medication. So ang buhaton sa patient is that musunod sila, maminaw sila para sa ilang nga kaayuhan, di ba?
Oh, important magud ang counseling sa diabetic patient kay since di naman siya mag-adhere sa iyang medication. So, kailangan siya i-modify gud sa iyang lifestyle pattern kay since
Mm.
progressive and lifelong jud na disease ba.
Mm. Kay dili man siya dili kaning from the word chronic, so dili na siya ingong maayo dayon siya in the instant murag dal-on na ni niya hangtod sa hangtod kani nga sakit. So, yes. Ang iyaha ra ba kanang pag-manage ra ba? So, next slide ang ikuan. So, yes, type 2 diabetes. Yeah, nga naman guys, nga naman tang napunta aning type 2 diabetes. Why did we
Okay, usually
yeah.
type 1 magari sa tunggikan pagkabata mga
Mm.
diabetes.